Wouldn't it be amazing if we start to see more of this?
Oh, I saw it and she hit me like that. Saw that thing so beautiful.
Wouldn't it be amazing to see more black doctors? Yeah. And that was actually a video from America, I believe. But over here, there are a lot of black doctors. They don't really get that shine. They don't really get that recognition. But should they? Yeah. Let's put some shine. Let's put a spotlight on some black UK doctors. This lady here, she's talking about UK doctors that are dermatologists, like their specialty is black skin.
If you know someone who's looking for a black female professional to help them with their skin, hair or nails, send them this video.
I'm Dr. Elioja Chimugu. I'm a hair transplant surgeon and a paediatric surgeon.
My name is Dr. Miriam Balogun. I'm a consultant dermatologist based in London.
I'm Dr. Yvonne and I'm a GP with a specialist interest in dermatology and skin of colour.
Hi, it's Dr. Moira, dermatology registrar.
Hi, I'm Dr. Sharon Bellman. I'm a consultant dermatologist.
My name is Dr. Sarita Dor and I'm a GP with an extended role in dermatology and skin surgery in London.
I'm Laura Jones, certified trichologist.
Hi, my name's Dr. Evan. I am a dermatology registrar.
That's amazing. I think that is amazing. However, a lot of them say they specialize in skin. Now, can you specialize in skin and not know about melanin? Shouldn't you be getting some form of melanin education? And where is that education coming from? What are you being told with regards to melanin? What are you being told with regards to melanated skin? And chemicals? Like, do they know this?
Have I been lied to as a Florida man about sunscreen protecting me from cancer?
Yes, it appears we've all been lied to, unfortunately. This massive study of over 470,000 people confirms it. It's very worrisome that when they compared sunscreen users to non-sunscreen users, the sunscreen users faced increased risks of all the major skin cancers: melanoma, squamous cell carcinoma, and basal cell carcinoma. So all of these cancers were up, but the most worrisome finding was that invasive melanoma was 300% higher risk in the sunscreen users. They accounted for skin color, time spent outdoors, and many other things, sex, age, and they still found these increased risks of the cancers. So when you use sunscreen all the time, you're blocking your body's ability to synthesize vitamin D, which is critical for cancer defense. So you do not want to shut that off. A JAMA study just came out and found all of those active ingredients in the sunscreens get into your circulation. They get into your body above FDA regulatory limits.
Look at that. Now, shouldn't all of the black doctors be taught this? Yeah, so we don't have black doctors going around talking about, yeah, black people, you need to put on sunscreen, black people. This is very important information that every black doctor should know, shouldn't they? Now, let's go back to this sis who done the previous video, who was introducing all of those black doctors. She was on a podcast, a popular black podcast, and they asked her about this this topic with regards to black people wearing sunscreen. Listen to what she said.
So my husband is Ghanaian, grew up in Ghana. We went to South Africa for the first time and he got sunburnt and he was like, how did this happen? He was and I was like, well, how dare you go on holiday with a dermatologist and not wear sunscreen?
I feel like there's a common misconception within the community that people with darker skin tones don't need sunscreen and that vitamin D, for example, isn't that important. Could you please clarify that?
Yeah. And I mean, to be honest, this in itself is actually a controversial topic, and it's also something that we need a lot more research on. But the research that we have so far, in terms of do black people need sunscreen to prevent skin cancer?
Do black people need sunscreen to prevent skin cancer? What do you think she's going to say? What do you think her answer is going to be?
But the research that we have so far, in terms of do black people need sunscreen to prevent skin cancer, the answer is probably not. So when they've looked at the mutations that people have in skin cancer, when you are of a darker skin type, it's probably not related to the sun. And that makes sense, right? Because we know that people, when dark skinned people develop melanomas, they're more likely to be on the fingers, on the toes,
like
on the
Bob
nails.
Marley.
Like Bob Marley, exactly. And you don't get sunburnt on your toes. So we know that the majority of skin cancers that are serious in darker skin types are actually not UV induced. They're not due to sun exposure.
Okay, well, there you go. That's it. I mean, shouldn't every black doctor know this, especially if you're a dermatologist? Like, she just laid it out. Surprisingly, she said, nah, black people, we don't get skin cancer like other folks get skin cancer. Our quote unquote skin cancer is in areas where the sun doesn't even shine. You'll get it on your hand or your on your foot or your toe or something like that, which means it's not UV induced. In other words, it's not caused by the sun. Yeah. Every black doctor should know this. No black doctor should be going on TV talking about black people, you need to put on sunscreen. Black people, like, if she knows this, why don't you know this? Yeah. If she got this education, why didn't every black doctor get this education? Now, with that being said, look what she goes on to say.
However, there are other reasons why a black person would want to wear skin sunscreen. That's to prevent sunburn. So you can get sunburn. So my husband is Ghanaian, grew up in Ghana. We went to South Africa for the first time, and he got sunburnt. And he was like, "How did this happen?" And he was and I was like, "Well, how dare you go on holiday with a dermatologist and not wear sunscreen?" And he was shocked. And it can happen because UV indexes are different. Doesn't matter if you grew up in Ghana, if you've seen sun 365 days a year in different parts of the world, you'll be exposed to different UV index, and you can get sunburnt as a black person. So that's one reason to wear sunscreen. Second reason is a lot of us are trying to treat or prevent hyperpigmentation. And by far the most important thing you can do from that aspect is wear sunscreen, without a doubt. So a lot of people will make sure that they put sunscreen on their face every day for the management of hyperpigmentation, which is the main reason why I wear it. And the third reason is this anti-aging. If you want to, slow down, aging is a privilege. Some people don't care. Absolutely fine. But if you do want to slow down your risk of developing wrinkles, and for darker skin types, a lot of our age shows in dark marks. I mentioned that we wrinkle later, but sometimes it's the dark marks that gives away our age. Again, wearing sunscreen is useful for that. So there are lots of reasons to wear sunscreen, but the problem is all the messaging out there is like, wear sunscreen to prevent your skin cancer risk, which is totally reasonable because this country is predominantly white, and that is correct health messaging to go out, but it doesn't necessarily apply to our community.
It doesn't necessarily apply to our community. And unfortunately, she, for some reason, didn't get the memo with regards to sunscreen. Regardless of what you're using it for, it causes cancer. You can just hear what the other video said. Regardless, whether you're using it to protect yourself from the sun or, my Lord, she said for anti-aging, using sunscreen for anti. Listen, you put on sunscreen, you become an experiment. You don't even know what that chemical is doing to you. 10 years down the line, you've got some type of cancer. You don't even realize why you've got that type of cancer. This is why it is my conjecture that every black doctor needs to be taught about melanin, how to take care of their skin, how to take care of melanated skin. Yeah, because as you guys know, there's a difference between melanin and pheomelanin. The black and brown type is melanin. Every doctor should know this. Every doctor needs to learn about how to take, every black doctor needs to learn about how to take care of melanated skin, melanated organs, and even neuromelanin, the type that is in the brain. Every black doctor should know about this. Every black doctor should know about the 12 melanated centers that are in the brain. Yeah. And I'm sure we've got some people from the NHS tuning in tonight. By all means, you guys can raise your hand and ask your questions or make your comments. This is an open forum, but this is my conjecture. I truly believe that every black doctor needs to know this stuff. I feel like it's your duty to know this stuff. You can't call yourself a skin specialist or a specialist in dermatology or that sort of stuff, and you haven't learned about melanin. That doesn't make sense. So yeah, I truly believe every doctor, especially here in the UK, but everywhere, every black doctor should have melanin education and learn about melanin. Now, if only there was a book that could teach them. If only there was a book out there where they could learn all of this stuff. Wouldn't it be amazing if there was a book for all of these doctors that they could learn this stuff, learn about the elephant in the room. Yeah? Because if not, yeah, what are they gonna learn? I'm being serious. What are they gonna learn? Like if they don't learn about melanin as a black doctor, what are you gonna learn?